But thank you for coming and welcome to the information session on the Masters of International Public Health Classroom in the Field program, the Philippines. So the Classroom in the Field program, the Philippines, is an exciting and pioneering innovation that is being launched for the first time this year. It is the result of years of planning and negotiations that I began in 2010, culminating in this genuine collaboration between Sydney School of Public Health, Sydney Medical School of the University of Sydney, and partners from the Philippines belonging to the public and private sectors. These partnerships have been formalized with the support of the Office of Global Health, led by Professor Marilyn Walton, Director Daniel Summers, and their team. Our distinguished partners, namely the Health Human Resource Development Bureau of the Department of Health, the University of the Philippines, Manila, the Zwelig Family Foundation, and United Nations Population Fund Philippines have all agreed to support these student field placements as we share a common goal, that is to teach students to become culturally proficient health professionals in an interdependent world. Through a health system-based, community-engaged teaching and learning approach, this Classroom in the Field program is an example of a transformative international public health education program. Let's meet our partners. In July 2012, Professor Robert Cumming and I met with our partner institutions to discuss ways on how we could work collaboratively, whether that's teaching, research, or student and staff exchange. Senior level staff in these institutions graciously took time to coordinate these meetings and site visits. Now, I don't know if you can see me. I know I'm so short, but that's me. Bob is just extraordinarily tall. So this slide shows us visiting the University of the Philippines, Manila, also known as UP Manila, and we were hosted by Professor Nina Gloriani, who is the dean then of the College of Public Health. The University of the Philippines, Manila, was established over a century ago and is the premier state university of the country. It is where all the health faculties and units are located. Among these units are the College of Public Health, recognized as one of the Southeast Asia Ministers of Education Organization, or SIMEO, Tropical Medicine and Public Health Network regional centers in Southeast Asia. It is the only public health granting school with undergraduate and postgraduate degrees in the country. Now, the College of Medicine, the one with that beautiful statue there, is where I graduated. It is renowned for producing leaders in clinical medicine and research in the country. UP Manila also is the home of the colleges of nursing, allied medical professions, pharmacy, dentistry, School of Health Sciences, including the National Institutes of Health, the Philippine General Hospital, and the National Teacher Training Center for Health Professions. UP Manila is very much respected in the country and distinguished for their outstanding achievements in healthcare delivery and community-based programs that serve marginalized people in very poor communities. These programs and services address major health problems as UP works with the national government, policy makers, local government units, and other academic and professional groups. So this picture is taken, of course, as we paid our courtesy call with the Vice Chancellor for Research, Dr. Vicente Belisario, and Vice Chancellor for Academic Affairs, Dr. Georgie De Luna. And you will learn this, that when you go to the Philippines, you pay courtesy calls wherever you are, in whatever partner institution you're affiliated with. Now, this is a very good one. It's a community site visit to San Juan, Batangas, which is a few hours outside of Manila. Dr. Elizabeth Paterno is the director of the Community Health Development Program of UP Manila under the umbrella of the Office of the Chancellor. So Bob and I went on a community visit with her. We were able to observe a blood donation campaign, which was actually held in the local town hall. And then Bob and I attended a community meeting wherein a lot of the community members were talking about strategies in solid waste management. the meeting was facilitated by UP Manila medical interns. So you remember your tutorials and how you have your skills in facilitating? Well, that is where it's going to happen. Okay? So the next partners now. Now this is exciting. It's the second partners are the United Nations Population Fund, or formerly known as United Nations Fund for Population Activities. This was championed by Dr. Angelita O'Malley, an MIPH graduate, who now is the Maternal and Child Health Coordinator of UNFPA Philippines. So Bob and I met with the highest ranking UN official of the country, and that's Mizugochi Daniels, right next to Bob. And it's because of her very strong support that this engagement happened. UNFPA's mandate is to achieve universal access to sexual and reproductive health, including family planning, promote reproductive rights, and reduce maternal mortality in the country. Their programs aim to empower and improve the lives of Filipino women and young people by focusing efforts in understanding population dynamics, human rights, and gender equality. This was taken this year, last July, when we finalized arrangements with the placements with Dr. Vicente Hurlana, and of course that's Angel, who is the National Program Officer for Population and Development Advocacy of UNFPA. The third partner is an incredible philanthropic organization called the Zwillig Family Foundation. It was built by brothers Dr. Stephen Zwillig and Gilbert Zwillig, who actually come from the corporate world. The foundation focuses its efforts on improving health outcomes for the poor by working with local government units and other partners to strengthen capacities of public health care systems by improving access to primary health care services, particularly in geographically displaced and isolated communities in the country. Two outstanding programs that have received acclaim and are being replicated by the Department of Health are the Foundation's Health Leadership Capability Building and Community Health Partnership programs. Both programs are anchored on the principle that health leadership is vital to public health care reforms. These programs show that improvements in health leadership lead to improvements in health governance, community participation, and health services, which produce better health outcomes and ultimately draw us closer to attaining the Millennium Development Goals in the country. So these are the very, very dynamic staff of Zwillig, and led, of course, by the President, Ernesto Garilao, Vice President Mon Derige, and Professor Jaime Galveston, who was the former Undersecretary of Health of the Philippines. The last but certainly not the least partner is the Health Human Resource Development Bureau of the Department of Health, led by the Director, Dr. Kenneth Ronquillo. The HHRDB partnership was led and facilitated by another MIPH graduate, Dr. Eden Mendoza. So the HHRDB developed the Doctors to the Barrio program. This encourages medical doctors or graduates to work for a few years in rural communities, especially where there is no doctor. Classroom in the Field, or CIF, offers 2 funded places, made possible by Professor Glenn Salkold, who's the head of school of Sydney School of Public Health. These scholarships will cover airfare and accommodation expenses while in country. Selection will be based on expressions of interest, an interview, academic performance, and skills in consultation with partners in the Philippines. Students will be doing 8 weeks of field placements that will start in late November of this year and finish in late January in 2014. Allocations to partner institutions will be done by the CIF Program Coordinator, yours truly. As this is mainly an educational program, the CIF hopes to provide students with activities geared towards the following learning objectives. We hope that students will gain a contextual understanding of on-the-ground approaches to international health issues like maternal and child health, health inequities, health human resource development, health governance, leadership training, and capacity building in the Philippines. We also hope that they gain an insight into community-based educational programs and community mobilization as they learn about Filipinos, their health-seeking behaviors, and perceptions of illness. We hope that they get an introductory knowledge and understanding about the complexities of the Philippine health system, how the brain drain of health professionals is being addressed by the Health Human Resource Development Bureau, and how health programs are implemented on various levels: national, regional, municipal, city, and village. We also hope that students gain an insight into how the various stakeholders work together. In this case, you have an academic institution, an NGO, an aid agency, and the Department of Health, all contributing to healthcare delivery in the Philippines. Now, who can apply? Well, all of you who are currently enrolled in the Masters of International Public Health degree and taking any one of the following elective units. So the 4-credit point International Health Independent Study 2, Global Communicable Disease Control, Women's and Children's Health, Culture, Health, Illness, and Medicine, and Health Systems in Developing Countries. What is expected of you? Well, you're supposed to submit all your assignments in all the electives, plus submit a report by February 15 of the following year. You are also expected to present at the MIPH seminar series or a special international public health placement seminar in semester 1 alongside the HOCMI scholars and the ISINDIAC scholars. We would like you to submit an audio or PowerPoint presentation as an e-learning international health field placement resource. Or any of the MIPH academic staff shown on this slide will be happy to be your supervisors if you ask them. Of course, you'd have to also consider that they may be unavailable, so just make sure that you have a plan B, plan C, plan D, whoever else you want to ask, okay? My name's not there, but I'm the last resort. Well, I'm going to be your overall supervisor anyway. Okay. It has been remarkable that I have been able to recruit volunteer mentors and local supervisors for this program, both here in Sydney and in the Philippines. These young, energetic, and inspiring Filipinos have all come on board to share their expertise and skills, organizing the pre-departure orientation program and assisting successful applicants with their pre-travel preparations and while they're in country. Local supervisors in the Philippines will be allocated by the partner institutions. I think I have one mentor right here in the crowd. DJ, I think, is sitting just at the back of the room. Okay. So here is the application timetable that you will find on the application form. So applications have now opened. The closing date is on September 15. Interviews will be on September 25. And then the results will be announced first week of October, and an orientation seminar on the Philippines is on October 10, 10 a.m. to 2 p.m. So all this information can be found on Blackboard or the learning management system of the university. So you should all have access really to this folder called 2013 International Independent Study. Within this folder is the CIF link, and you can download the application form in this site. So I'm hoping most of you have seen this folder? Yes. Okay. Completed applications, which should include your CV and resume, including a photo, should be emailed to Ms. Fiona Thien. She's with the Office of Global Health. She's the administrative officer, and she's here with us today. And this should be submitted on September 15. That's a Sunday. Applications received after the deadline will not be accepted, and we cannot give extensions. So I hope that's clear. Now, we would like to really encourage you to read the instructions carefully so your application will be processed. Submission must be in one attachment only, either Word or PDF file. Applications will be reviewed within a week. Students who have been shortlisted for an interview will be contacted via email. Interviews will be done by a panel of Sydney School of Public Health staff, and successful applicants will be notified via email. The applications will be assessed based on the following: the quality of the expressions of interest, strength of the applicant's interview, your academic performance, qualifications, some skills, a little bit about work or field experience. However, we know that most of you may not have experience in the field, and maturity. Selection is also going to involve consultation with Philippine partners, as they are very much interested in knowing who the students are going to be and who will be partnered with them. Let me end by saying anyone who stops learning is old, whether you're 20 or 80. Anyone who keeps learning stays young. So I think we all want to stay young. So let's not lose our energy to learn constantly. Thank you, and see you in the Philippines.